nutraMetrix, the market for nutraMetrix is ideal right now because more and more conventional medical people are starting to refer out to other practitioners for adjunct therapies, especially to allied health professionals. And this wasn't happening so much back in the day because there was this distrust on the part of traditional medical practices about what chiropractors and massage therapists and acupuncturists do. Yeah, they didn't really think they were needed. But I think what's happening, what I've read is happening, is that the consumer, the patient, is getting smarter and better educated on taking care of their health holistically. So they're going into their mainstream medical doctors and they're saying, well, you know, I've read that chiropractors can fix that problem without surgery, and I'd like to give that a try. What do you think? And the medical doctor's saying, well, yeah, probably, so here's somebody I can refer you to. Or they're reading a lot about nutrition and how they can control a lot of their health issues by what they eat, thoughtful supplementation and everything. And a medical doctor is not generally trained in those areas. So they're having to send them out to a registered dietitian or bring one into their office. If they bring one into their office, they're not losing revenue. But if they're always having to refer out, that could be a little stream of ancillary revenue that they could be having in their own office. So it's just a perfect point for them to be open to this kind of thing. So the traditional medical practices are referring out to the allied health professionals, and then the allied health professionals are referring back to the traditional medical practices. And how do we fit in? We're, as nutraMetrix consultants, we're all passionate, and I know many of you, about changing the health of our community by facilitating these partnerships between people. Not only that, but we can go into a traditional medical practice and help them bring in some of the revenue from what allied health professionals generally do into their own practices through our products and our services. So this is a great time right now for this little trio to be working together, and I'm really excited about it because we can have a huge impact on our community, and we can bring the two groups together, and I like to see that happen too. That's a lot of fun. So why nutraMetrix right now, too, is the rising business and drug costs. Drug costs continue to rise. They're coming up with more and more expensive formulations. Business costs continue to rise. States are having higher minimum wage costs. People still want to have insurance if they can get it. There's just a lot of things going on. And also, a lot of our younger doctors in particular are opening their practices with huge, huge debt from their education. They're shrinking insurance reimbursements. That is happening all the time. I don't know if you go to the doctor, the insurance isn't paying as much as they used to. So a lot of people just don't go to the doctor if the insurance is paying. And not only are they not playing with their health, that's revenue the doctor's losing as well. And when the Medicare comes and goes and everything changes, there's just nothing steady they can hold on to as far as insurance reimbursement. And then changing regulations and reform initiatives. It's so crazy out there in the healthcare world. You never know what's coming. They don't know what's coming. So how do you plan for that? How do you ensure that you have enough income coming in to support your practice? Yeah. And they're looking at the moment for other ways, other streams of income, just like any other kind of business or professional person. They're always looking for other streams of income. This is a huge one, dissatisfaction with medical outcomes. People just aren't happy. They're just not happy with some of the treatment they're getting because it's all very, or not always, but sometimes it's just very one body part specific. Like my dad, he fell, broke his hip. They're not looking at his back, even though he says that's where the pain is because they're concentrating on his hip. So there's just a lot of dissatisfaction with the consumer, and we get less time with practitioners. And I know a couple of doctors, and really they have 10 minutes. They have 10 minutes with you, or they have to report to their superiors why it took them more than 10 minutes. So we're seeing more nurse practitioners, which is great because they're just as qualified for the kinds of things that they do with us. But still, people want time with a doctor. They want to talk to their doctors. So they're dissatisfied with that. Unwanted side effects of pharmaceuticals. There's so many recalls right now. There was a couple of thyroid medicines recalled. There's been a blood pressure medicine recalled lately. And these are all FDA-approved medications. And the sad truth is, anytime you put a chemical into your body, it's going to have some effect. It's just going to have some effect. And people are noticing that more and more. You think, you know, you watch TV and the ads are just like, and fourth of it is about the pharmaceutical. The rest of it's about the side effects. So they're looking for alternatives. And a gal approached me yesterday, and she's on some medications. And she says, you know, I'd like to really see what could I use that would help support my body systems. And maybe I could cut down on some of the medications I'm taking. So people are getting more educated, and they realize that what they're taking is sometimes dealing with a problem, but making them unwell in other areas. And surveys indicate that patients prefer to receive wellness services from their own providers. I tell my doctors this all the time because I think they forget. You know, the ones who send their patients who ask them, what kind of calcium should I take? And they tell them to go to GNC. They forget that we really want you to tell us. You're not selling us anything. We're giving you our bodies. We're giving you our illnesses. And we want you to tell us about everything you can tell us to be well. Yeah, we don't consider that you're selling this to us. I think that's just a huge, huge thing right there. And especially, I'm in my 60s now, especially older people, we want to have a one-stop shop, if you will. You know, help me stay well and treat whatever illness happens. If I can find a doctor who will do that, you've got a patient for life. You've got a patient for life. And especially if you're offering me wellness, I was just telling this young man yesterday, I said, what do you do between treatment plans to keep your patient coming back to you? Yeah, or when their treatment plan's over and they don't need a chiropractor anymore, what do you do then? You offer them other services because they're looking for them anyway. And they want you to tell them because they trust you, they like you. So to me, this is huge right there. That's just really huge. And patients are already using supplementation. I mean, you go into anybody's house, you're going to see what? A multivitamin in the big case, or the big jar that you can get from Costco. You're going to see fish oil. They know about those things, multivitamin, fish oil. They know about vitamin D now. So they're trying different things, but they're trying it with no guidance at all. Yeah, they're spending money on stuff that they don't even know if it's going to be beneficial to them based on what's going on in their bodies at the time. It's always useful if the doctor knows what supplementation you're taking. But if you buy your vitamins at Costco, the doctor might not know that. You might not even think to tell them that. Yeah. So if you get your supplements from your health provider, it's the whole picture. They have the whole picture of what's going on with you. And more people want to use natural approaches. They're watching Dr. Oz. They're watching Oprah. They're watching all these things that say, you know, try natural before you try pharmaceuticals. But they don't know how to do that. They have no idea how to do that except to go to a GNC or a Whole Foods and stand in front of those shelves and shelves of bottles and try to figure out what is natural and which one do I actually need. And again, they're doing that without the help of their health professional and without any thought to the medications they might already be on and everything. So patients are looking for it, and I think we're doing them a disservice if we don't offer that kind of help to them. $40 billion is spent on supplementation annually. Yeah. And unfortunately, I think a lot of it's just not even useful. And that makes me very sad. Yeah, that's part of my passion is people are spending this money. They're trying to get healthy, but without guidance and without decent supplementation, it's very difficult to do. So an $80 billion is spent on weight loss annually. Yeah. Right there, to me, that should be in a doctor's office. Weight loss should definitely be in a doctor's office. You know, even if it's just a box of trim tea to start. Yeah. And then work into the TLS program, because that is the root of so much illness. But people are not being successful because they're following every new fad that comes out. And they want their doctor's help with this. And we give them a solution, out-of-the-box solution. They don't have to come up with anything. I think it's absolutely brilliant. So people are already providing ancillary services of family physicians. 23% of them are. All these different kinds of things. Nutrition counseling you find everywhere. Massage therapists you're finding more and more in mainstream doctors' offices. Weight loss services, but those are so different. I mean, some doctors follow all the fads. Some doctors do HCG. Just lots of different things. So, but the point is, it's already being done. This is not something new and crazy we're taking into a practice. They already know about it because they're already doing it. And it says that some primary care practices may be able to earn as much as 15% or more from ancillary services. This is huge. 15% is a lot of money when you have to cover your costs and pay back your malpractice insurance and pay back your student loans. Yeah. So some of the things that we offer that they're not going to get anywhere else are these custom cocktails, where we can come up with a custom cocktail formula, unique formula for the practice. We can put Dr. Smith's joint support formula on it. So they have success with it because these are isotonic, and they feel the effects of it, and the doctors thoughtfully put it together to target what most of her patient base has. So when they run out, where are they going to go? They can't go get this at GNC. They're going to come back to the doctor's office and say, I need Dr. Smith's joint support formula, please, because they're going to notice they don't feel as well without it. But we can also customize unique formulas for each patient. And I've seen doctors do that because they know a patient needs this certain formulation of our product. And so they just make it Jane Jones private blend or something like that. Well, she's thrilled because it works and it's made just for her, and who she's going to go get it from. She's going to get it from the doctor again. We have a nutraphysical assessment that helps the doctors with recommendations. We've all seen reliable patient results. And the thing is, you get compliance, because nothing works if the patient's not taking it. This makes it so easy for them to take, and you're going to get more frequent reorders. Yeah, because there's just no guesswork. All you do is scoop and drink, and you're on your way. The GeneSNP DNA analysis, what they were talking about, the improvements they made, and in the results that you can read and everything, I think it's so brilliant. It's a nutrigenomic tool. It guides the practitioner as to how to help their patient best, taking into account the diet, lifestyle, and gene environment. For me, this was huge because I took it and I found out I don't metabolize B vitamins, for example. No doctor looking at me or just doing standard work would be able to see that. But after I saw this, I knew I had to take an activated B in order to keep my B levels up. It's an amazing tool. It gives the doctor so much insight into their patient. And it also ensures that the patient is not wasting money, on stuff that might or might not touch what they need. It's a laser approach to customized nutrition for optimal wellness. I think this is an amazing product that we can offer them. And it's at a really good price point compared to what's out there. Yeah. So, and then of course, TLS Select Weight Loss Solution, clinically supervised weight management program, where you get healthy and weight loss is a side effect. I'm astounded by how much people are paying. They're dropping $3,000 for something where they go in and get a packet of pills and they get weighed and something, but nobody's teaching them how to eat. And that's what we do. And I love our support supplements that help you get control of your whacked out hormones. We have online support tools, and this is customizable to each and every patient. That's huge. And we give the doctor all the tools they need to do this simply without having to reinvent the wheel. Because most of them would like to have weight loss, but it's just overwhelming to think, how do I come up with a weight loss program for everybody that works for everybody? And we offer it to them right here. And if they can see the value of that, then they can change their practice seriously. So I like this sample retail model because this is so incredibly doable. The weekly action is you have 3 patients each week start on nutraMetrix Daily Essentials packets. At the end of the year, because not everyone's going to stay on it, but most people will because they feel better, you're going to have 100 patients purchasing this product, which leads to a monthly retail profit of $2,200 a month. This is a clear outline of how something so simple that benefits your patients can also benefit your practice. And in the case with the doctor I was talking to yesterday, he's not actually taking any of our products. So I suggested to him, take 1 month's worth of these Daily Essentials packets. Then you will have no problem talking to people about them, because I guarantee you, you're going to feel the difference. Because everybody I know who takes this has felt a difference. Yeah, because they're actually getting nutrition into their bodies. So we set a goal. They're the bigger practice, so they're going to try to have 2 patients each week start on the nutraMetrix Daily Essential packets, and the other office is just get smaller and starting out, and we're going to go for 1 patient each week there to come up with the 3. Because he saw the value. I said, you see the value of $2,200 a month extra coming into this practice, not just for the owner, but for all of you. Yeah. And he did, and he didn't know that we were talking about that kind of money, okay? Wait, what happened to the other slide? No. So there's 3 different account types that we have that we can help you meet your business objectives. The first one we call an HP1. It's an introductory account, and that's designed for the smaller practice or for somebody who's just starting with the idea of a retail initiative in their practice, and they're just going to concentrate on that. They're not going to worry about expanding distribution. It's simple, it's easy, they can make money on it, like you saw on the slide before, something simple as that, and it's automated. And they can change any time to becoming the HP executive. And that's for people who really want to leverage our solution with their referral network. Of course, we're going to work with HP1 referrals as well, but it's not an emphasis like it is in the HP executive. And then for people who want to be a nutraMetrix consultant, we're non-health professionals with full access. So we work with health professionals and we leverage our solution with their referral network. It's a really beautiful thing, the nutraMetrix, being a nutraMetrix consultant. Working with health professionals, actually, I mean, how many of us have the opportunity to actually influence the health of our community? We can do that 1 health professional at a time with this program, and I'm really proud to be a part of it. So as you're looking at this, you're probably thinking of people you know. Yeah, because we all go to the doctor, we all go to get our eyes checked, we all go to the dentist. You know, I go to a massage therapist because I think they're amazing. We've all had babies. There's just a lot of different people you know, and who could they lead you to? Those are the 2 things we have to keep in mind. And don't be afraid to just say, hey, you know, I work with nutraMetrix. We have custom health solutions for all health professionals. Do you know anybody who might be interested in expanding their wellness program in their practice? And could you put me in contact with them for a 10-minute appointment? Yeah, it's just pretty natural to do that when you're in conversation with somebody. And how do you get started? If you haven't attended a nutraMetrix 101 or a 201, you should. They are an amazing training. The 101 is for everybody. Yeah. The 201 is more detail about doing the business, but you can go to any of them. Anybody can go to any of them because all of our trainings are open for everybody and we don't know what's going to hit. I have one customer, she's been to 2 TLS trainings already, including the business one, and she loved it all. So don't be afraid to invite people to these kind of things, even though they look like that might be too much detail for somebody. So the other advantage is if you go to one of these, you can be granted temporary nutraMetrix consultant status for a period of 3 months with the purchase of a 3-day nutraMetrix consultant training ticket. So this is a great program. I'm really glad they came up with it because it helps people get started faster. And you can ask your local coordinator to schedule a nutraMetrix 101, 201 in your area, and they can arrange to have that done. So join the wellness movement. It's a great place to be. It's an exciting time right now in America because we're so sick, but people are wanting not to be sick anymore. And we have the unique opportunity to make a difference in the health of those we care about while building a solid foundation for our business by following an easy to implement system. This is, to me, the key. Is it's so easy for these business doctors with our help to implement the system into their offices. So whether you're a health professional or looking to be a nutraMetrix consultant, it's your time. It's right now. You can lead the wellness community, the wellness movement in your community and be really proud of what you have to offer. Yeah. So I